This is Jessica's second surgery, and what's different about this, she basically said her nose was over resected, which means too much cartilage was taken out. And when we look at her preoperative photos, we'll see that she has a dip in the lower dorsum called the supratip. And then if we look at her nostrils, they're collapsed in. Those are called the alar grooves. And that's usually from over resection, or if you take out cartilage, sometimes cartilage that's straight, and that's the tip of the nose, will sometimes become concave and bend in the airway. And that will make the whole airway pretty poor because you have what we call concavity. So now when we look, we built up with a diced cartilage glue graft, the middle valve here, deprojected the tip slightly, added a diced cartilage glue graft over in this region right here, a little bit along the columella. We lifted up this part here called the columella here with a tiny groove. But most importantly, this here was caved in more on this side than the left side. So we have lateral curl strut grafts, pieces of cartilage underneath whatever her over resected cartilage that remained, and that opened that up a little bit. And what that will do is take care of the airway. If we look at the before photos of the base, you see the nostrils are collapsing in. With the articulated rim grafts and the lateral curl strut grafts, we can see the contour of the alar rim is much improved. So one, I hope she'll be able to breathe better, which she should. Two, her nose looks more natural. One of the things that Jessica wanted was a natural looking nose, not an over resected nose. So that's what we were able to create here.